Hi, my name is Alex Grushi, and today I will be presenting pathological fracture as presentation of generalized lymphatic anomaly in an 8-year-old, a case report. Generalized lymphatic anomaly is a rare condition in which lymphatic vessels form aberrantly throughout the bone, soft tissue, or any organ that has lymphatic tissue. This multi-system disorder commonly affects the liver, spleen, lung, skull, long bones, pelvis, and vertebrae. Hence, the usual presenting symptoms frequently include abdominal pain, respiratory distress secondary to chylothorax, pleural effusions, and lymphatic infiltration of the lung. Asymptomatic cases are diagnosed through incidental findings on imaging. This case report is of an 8-year-old that presented with a pathological fracture and later was diagnosed with GLA. An 8-year-old male presented with pain in the right arm after falling during a dance practice. X-ray of the right forearm demonstrated pathologic fracture of proximal right radial diaphysis with underlying lytic lesions concerning for osteosarcoma. Further lytic lesions were also observed in the right humerus. A skeletal survey was performed that revealed a mediastinal mass and scattered axial and appendicular bone lesions suspicious for bony metastatic disease. Due to concern of suspected malignancy, a metastatic workup including CT of the chest, abdomen, and pelvis and laboratory testing was conducted. The CT scans confirmed the presence of a large cystic mass in the mediastinum extending to the thoracic inlet and left neck, encasing mediastinal structures. At this time, lymphangiomatosis was high in the differential due to scattered lytic bone lesions in the cystic mediastinal mass. However, malignancy could not be excluded without biopsy. The cystic lesion was drained under ultrasound guidance and bone samples were obtained with CT-guided biopsy of the left iliac crest. Flow cytometry of the aspirated fluid excluded leukemia or lymphoma. Abnormal development of the lymphatic system can manifest as rare benign vascular anomalies known as lymphangioma or lymphatic malformation. When these become widespread, the condition becomes known as generalized lymphangiomatosis or GLA. Due to the rarity of the condition, the clinical features are not completely characterized, and the cause and prognosis of the disease are poorly understood. Prior case reports in patients with suspected GLA have reported involvement of the bones, mediastinum, spleen, liver, lungs, neck, and pleura. The prevalence and incidence of the disease are likely underreported due to asymptomatic presentation in many patients. If symptomatic, typical complaints include difficulty breathing, abdominal pain, ascites, and other symptoms due to the compressive effect of the large cystic mediastinal masses. Theoretically, any organ can be involved except the central nervous system due to its lack of lymphatic structures. Although a classic lymphangiomatosis patient may present with complaints of respiratory distress and fluid backup, pathologic fractures due to lytic bone lesions are possible. Pathologic fractures in children may result from a wide variety of pathologic processes, including metabolic disease, infections, and tumors, although GLA should be considered in the differential diagnosis of a pediatric patient with pathologic fracture in the setting of multiple non-aggressive lytic lesions. Benign bone tumors such as unicameral bone cysts, aneurysmal bone cysts, non-ossifying fibromas, and fibrous dysplasia may predispose children to pathologic fracture. However, malignant processes such as metastases from neuroblastoma and Wilms tumor, leukemia, Ewing sarcoma, fibrosarcoma, and more can predispose to unexpected fractures. Thus, a thorough history, physical examination, and review of plain radiographs and advanced imaging are of utmost importance in distinguishing benign versus malignant causes of pathologic fracture. In patients with multifocal lytic bone lesions, an awareness of GLA as a differential diagnostic consideration is warranted. Increasing awareness about GLA is crucial to the early diagnosis and treatment of these patients. Delayed diagnosis is common due to the rarity of this condition and limited description in the medical literature.